Okay, so some basic healthcare procedures for a rat is making sure that they have food. They have a rat chow that is very good for the rat, and it's in pellets that helps keep their teeth trimmed so they don't overgrow. Hi, buddy. I'm not gonna pick you up yet. I'm just gonna pick your thing up. You watch out. So in his little carrier, they brought his food. I'm not stealing your food, don't worry. And it's just rat chow, and it has some seeds, and they put a banana in there for him, and the pellets. Hi, he's very friendly. I'm gonna shut you back in there for a minute. This is just his travel carrier, and it is a very basic travel carrier. It's pretty small. In the bottom of his cage, they also have at home is the matting so that he can burrow and chew it. Oops, I'm making a mess. Good boy. They can have food, free feed. Also, water should be given free choice. They should be able to have access to water at any time that they are thirsty. They can drink out of either a very small bowl that they can't tip over, but it should be up above, so that the animal isn't defecating or urinating in the bowl. Also with the food, it can also be either in a bowl like that or in a hopper. They can also drink out of a water bottle that would be attached to the cage and also above, so that there's no contamination. Let's see. Rats can have small amounts of fruits and vegetables and seeds, so long as it doesn't exceed their dietary needs, which can cause diarrhea and dehydration. For the basic handling, gentle handling, they're a little more hardy than the mouse. You can pick them up by the base of the tail, but you should never carry them by the base of the tail. They could slough. They're a little more hardy, so you could just scoop them up, and as long as you support their entire body, they should be okay. So that's just basic handling. And they do like to cruise and peruse. There you go, back in. Oh, you're okay. Don't freak out. Let's see here. And then, for identification, it's very similar to the mouse. They can have, for more permanent, they can do ear tagging, ear punch, toe clip. Those are more permanent. Also, there's the microchip. That's also permanent. Something a little less permanent, if they aren't, you could use coloring, as long as it's non-toxic. He's distracting me a little bit. Also, you could do shaving spots. I was trying to remember the other one I was trying to talk about. Okay, so some enrichment for the rat is the bedding, also so they can bury and chew toys that they can nibble on and chew. This is like a wood toy here, and he can gnaw on it and keep his teeth down. Gives them something active to do. Tunnels they can climb through, a wheel they can run in, toys that they could climb up and down on, just to keep them busy and active. They can be fed in a V-shaped hopper or with pellets, and it's rodent chow. They're also coprophagic, which means they will eat their own feces, sometimes at night. And they can be given small amounts of fruits, vegetables, and seeds to keep them going, as long as they're not overfed those diets, which can cause diarrhea and severe dehydration. Their cages should have a wire cage bottom that you could put paper towels or other types of bedding on that they can shred and chew and dig and bury themselves under. Okay, some restraint techniques for the rat is holding by the base of the tail and scruffing the neck to immobilize it. You want to grab a deep scruff so that they can't turn and bite you, because they do have some loose skin at the base of their neck. Another hold is over the thorax with your fingers, and stretch the rat out and hold them so that they can't wiggle and bite. You'll push the feet forward. You're okay. Making sure not to squeeze too tight. Where are you going? And you want to also immobilize the tail so that they can't. So I've got him locked. I just got my... You're okay. Don't eat me. You are very stubborn. Stop. You're fine. You're fine. So I've got him locked so he can't turn and bite. Okay, for determining sex and reproduction in a rat, it's very similar to a mouse. A male rat will have, more glands at the base of the abdomen and towards the base of the tail. They also have the os penis that can be visualized. This rat has been neutered, and as soon as he calms down on restraints, I'll show that there. The male will also have more space between the anus and the genitalia. A female, it's a shorter space between the anus and the genitalia. The female will reach puberty in 37 to 67 sexual maturity in 37 to 67 days. The male within 40 and 75 days, excuse me. The female will be in gestation for 22 days, and they can have up to 6 to 12 pups. The pups are born hairless until about 7 to 10 days, and then the eyes open at 7 to 14 days. Ears will open by 3 to 5 days, and solid food they can start eating by the second week. The pups can be weaned at 3 to 4 weeks. During mating, the female rat will have a vaginal plug, and that's how you know they might be pregnant after coitus. There is the... For mating, there is the intensive and non-intensive breeding. The intensive is when the males and females are housed together. The non-intensive is when they're housed separately. They can be monogamous. The two, male and female, can live together. And polygamous is when there's one male and multiple females, up to 10, I believe, was the number. I'm going to do a sub-Q if he calms down.
Easy, buddy. There you go.
So she's got the skin tinted. Stop, you're fine. Just go in, draw black back on the plunger, and inject. Okay. All right, we're gonna do oral. She's got a grip of him, and his mouth is open. And you always want to use metal so that if they bite, they don't. There we go. If they bite down,
Is it awful?
they won't break it off and swallow the tip. So there was the oral. Okay, Shannon's gonna help me do the blood draw on Zeus here. I've got warm compresses on his tail just to expand the blood vessel. You can use alcohol, but it has to dry all the way before poking. He's a little nervous. He likes to scream at us.
Turn for Zeus. It's alright.
So I'm gonna pre-loosen my needle. He's like, I don't want it. I know. No. Be brave.
Stop.
I know, I don't like being poked either.
Easy, buddy.
Oh my goodness.
Fine. You got it.
Oh, I did hit it. This is way more difficult than I thought. Some basic health care for mice are they should be able to have free feed of food and water with them for them at all times. They can be fed in a V-shaped hopper or with pellets, and it's rodent chow. They're also coprophagic, which means they will eat their own feces, sometimes at night. And they can be given small amounts of fruits, vegetables, and seeds. to keep them going, as long as they're not overfed those diets, which can cause diarrhea and severe dehydration. Their cages should have a wire cage bottom that you could put paper towels or other types of bedding on that they can shred and chew and dig and bury themselves under. When handling a mouse, you should always wear gloves, just in case you can get lepto, which is zoonotic. The best way to pick up and move a mouse just from cage to cage is by grasping the tail, and you can quickly move them over to where you want them and set them back in. You don't want to hold them by the tail for too long because it can deglove. Another way you could pick up a mouse is by scooping the body, especially with younger ones or ones that are used to being handled. The one I have is very feisty, so I'm going to do all of my restraint at once. He's very curious what I'm doing over here. Some types of identification that mice that are used in mice would be ear tagging, more permanent, ear tagging, ear clipping, toe clipping, tattooing, and microchips. Some not so permanent would be non-toxic colored markers and shaving, or shaving different spots on them, or just a cage card. Some enrichment for the mouse so that they can get some exercise and feel more comfortable being caged would be the bedding to burrow in, toys that they can play with and climb on and chew. A wheel is always good and gets them their exercise, keeps them moving. And then towels or paper towels, things that isn't going to get stuck in their poor little bellies if they swallow it. How are you doing? Oh, he's eating. And pellets, that kind of things that they can gnaw on, no plastic or rubber, things that they can get lodged in their throats. Okay, my mouse, since he just came in a little box, I had to borrow him from the pet store, rent him for the day, so to say. I just got him in a thick box that he cannot chew through and he cannot climb out of or jump out of. In the bottom of the box, I have just a little cup of water rather than the bottle, because the bottle that we have are for rabbits and larger animals, so the nipple on it was a little too big for him. So I just have, what are you doing? Just have little caps for water and for the food which he spilled, and I have him with the, oops, what are you doing? The mouse diet, don't know if you can see that, just some pellets. And I have paper towels and a towel in the bottom just to make him more comfortable, which he can chew on and won't hurt him. Hello, dude. So the best way to pick him up, I'm going to pick him up by the base of his tail and cup his body just so he's not going to hurt himself. He's pretty quick though, so we'll see if he'll cooperate. Hi, buddy. Stop it. Be nice. And you should grasp the tail with the non-dominant hand. You're okay. Settle. You're okay. So here's my mouse. He's a little less active today than he was yesterday. Another way you can pick them up is by the scruff of their neck, which he doesn't have much, but there he is. Oh no, he's angry. I'm just going to keep a good grip on his tail just because he's pretty wiggly and I don't want him to hurt himself. Here we go. Place him over the box in case he jumps, because he is a jumper. Another way you can restrain a mouse is by tucking their, hey, don't get angry at me, their head between your fingers, if he'll allow me. Stop it. And pushing their legs forward and having their tail clasped. I'm not going to let go of him because he is very, very wiggly. And this way I can oral dose him. If I have an extra person, it'd be a little bit easier. I'm just going to hold on to his tail. He's jumping around and I'm not used to holding them. I don't want him to get hurt. Hi, buddy. Okay, I'm going to put him back in, and I'm going to have my helper come and help me with the oral dosing. And I've just got the little syringe, little metal round tip syringe. And then for his sub-Q and IP injections, I'm using the insulin syringes. Okay, to find the sex, whether or not the mouse is a male or a female, you will look at the genitalia. Male mice have more glands in their lower abdomen, and it's easier to tell. They also have the os penis. Hi, buddy. I know, I'm not done messing with you. Stop. So this one, okay, Dorbrine ornery. This one is a male. There is more space between the genitalia and the anus. And I can tell he's a male because he also has the glands. And with males, oops, sweetie, they can reach sexual maturity within 50 days after being born. A female is within 50 to 60 days. Okay, I'm going to put you back down. You're army. Females have mammary glands. They have about, they have 5 pairs, sides and back, so down their bellies. They also have a membrane that covers the vaginal opening until sexual maturity, which is within that 50 to 60 days. They are spontaneous ovulators and continuously polyestrous. They have a 4 to 5 day estrus period. They also can undergo a postpartum estrus, which is about 20 to 24 hours after giving birth. Gestation period is anywhere from 19 to 21 days, and they can have anywhere from 10 to 12 pups. Males, weaning would occur within 3 to 4 weeks, and the eyes would open within 3 to 5 days. Hair will start showing around 7 to 10 days. With copulation, the female will have a vaginal plug that lasts about 12 to 24 hours, and that's how you can confirm whether or not the female will become pregnant. You can mate them by either monogamous, the male and female mouse stay together, or by polygamous, which is many males and females housed together. There is intensive and non-intensive mating. The intensive is just the female and male housed together. The non-intensive is the females are separate from the males and brought together at the time for copulation. All right. Okay, for sub-Q in the mouse, I don't know if you can see on this towel, not really, but you're gonna wanna tent the skin. Oops, there we go. Tent the skin, and the needle's just gonna go right under that tent. Hey, baby, you gotta stop wiggling. Oh, you're gonna be angry. Stop. I already pre-loosened my needle, or my cap, I should say. And the needle goes just under the skin. I know, baby. And you I gotta get a better grip of him. He's wiggling a little too much. Stop being a turkey. Okay. The needle goes just under the skin. Oh my goodness. All right. It's just under the skin, and I'm going to pull back on the plunger just a little bit to make sure there's no veins hit or arteries. And I'm going to slowly just, there we go. And there you got it. And no more. I'm just using sterile water for these. Okay, you can. All right, so Shannon here is helping me with the IP injection because he is quite the wiggler. So she's got his head tilted in a downward position, and I am going to just place the needle in this caudal area and pull back on my plunger to make sure that I haven't hit any organs. So I'm just going to use both hands because he's so tiny. My hands shake a teeny bit. You're okay, baby. I haven't even touched you. So I'm just going to poke, draw back. Oop.
Not the whole syringe. Sorry, buddy. No, stop it. Oh, you were so tiny. Stop kicking it. I haven't even touched you yet. Dude! Do you have an extra finger? Alright, she's gonna hold his leg since he's kicking me. You are a spazoid.
Yeah.
Alright, buddy. Alright, poke, and I'm gonna draw back. Stop kicking. There's nothing there, and I'm just going to inject. And like I said before, I'm just using sterile water since he doesn't need any meds. So there we go. You survived! Now you get to go home. Okay, so oral dosing of a cannula, you've got to make sure that the mouse is thoroughly grasping in your hand. If you have the cannula, you place it into the mouse's mouth and squirt it in. So he's good there. You want to use metal in case he bites down, he does not break it. So some basic health care that would apply to a rabbit would be trimming the incisors to keep them from having malocclusion so they can eat better. Also nail trims to both protect themselves, their litter mates or cage mates, or the handlers and owners. Rabbits are herbivores, which means that they typically eat just veggies, hay, that sort of thing. Their normal commercial pellet diet usually has about 15% protein, 10% fiber. Higher fiber would be good for a rabbit to prevent hairballs and to prevent weight gain as well. Fresh water should be available to the rabbit at any given time so that they can drink ad lib. Ad lib eating. The best permanent identification for a rabbit would be a microchip. There's ear tags, tattoos. Those are the most typical. Microchip is probably the easiest, the most permanent. Rabbits can live at cooler temperatures, which are usually about 62 to 70 degrees, 30 to 70% humidity. They can tolerate cooler temperatures than most other rodents. Some enrichment would be allowing them to chew and or dig in papers, be able to find their food, spreading their food throughout their cage during the day so that they have something to dig for and look for. You can also do tunnels, plastic tunnels, as long as there's no sharp edges, so they can dig and bury and explore. That'll keep them a little more busy. Branches for gnawing to keep their teeth down so you don't have to trim them is always a good option also. They also tend to like toys. They my research says that they would play with bird toys or cat toys as long as they're not too small, things that they can ingest and chew, which bunnies tend to ingest and chew things. That's all. So a typical diet for a bunny would include some sort of hay. Timothy hay is the one hay that comes up more frequently. So this guy gets this a couple times a week. And then also a little bit of a pellet food daily. And that just contains the protein that the bunny would need and some fiber that the bunny would need. And this guy has some pretty good teeth. It looks like he chews regularly. His teeth are nice and low. They're not yellow. They don't seem painful. Next, I'm going to show some restraint. This adorable little thing is Blue Bunny, which I'm pretty sure is an ice cream. And Blue here is a little bit hoppy. He likes to jump around, so I just have him wrapped in a towel with his legs secure against my arm, and I can cradle him and keep him from kicking. The best way to restrain is by scruffing the back of their neck, kind of like you would a cat, to keep them from moving, and it kind of calms them a teeny bit, and then scooping the back end to keep them from bouncing. So with Blue, I'm just going to scruff him as I unwrap him. Hi. He doesn't have much of a scruff, so he's hard to hold on to. Hi, there you go. A little bit of pressure on his back just to keep him from kicking and injuring himself. So you can see a little bit better here. Also, dimming the lights might help with the rabbit, or covering their eyes to keep them from being overly excited and being able to see. It'll settle them down a little bit as well. Also, to calm them, you can place a bunny on their back. And he's got some sharp nails, so I'm not going to mess with him too much until I get a chance to clip his nails. but there I'm holding his back end, my fingers, and I've got him scruffed so he can't move. Oh, you're so cute. All right, so I've got him supported. I'm going to gently set him down on a towel to keep him from slipping and keep him from bouncing. Don't. You're okay. All right. A good way to strain a bunny for like a nail trim or blood draw is also good to do like a towel wrap, a towel burrito around them to keep them calm and held tightly so that they don't jump around. Hi. In this case, a cutie, very soft. Okay. For rabbit reproduction, does typically mature quicker within about 5 months. Bucks mature within about 6 to 7 months. Breeding colonies would include 1 buck to 10 to 20 females. The doe would be taken to the buck for mating. Does are induced ovulators. They're also seasonally. Does ovulate within 10 hours after coitus, and the gestation period is within 29 to 35 days. And for a rabbit to give birth is called kindling. To find the sex of a rabbit, you go to their genitalia and you pull back their hair to kind of look. A female will just have a small slit. A male, if you apply gentle pressure, the penis will come out. And this one is a little boy, and he looks healthy. There's no marks, no growths, nothing abnormal there. So you're a little boy. You're a blue bunny. For a sub-Q injection with a bunny, it's similar to a cat or a dog where you're going to end up scruffing the neck. I've got this one burritoed. I've got my injection with just some regular sterile water. Uncap. Keep the bunny tight and close to you. Scruff the neck in the tent. Place the needle. And slowly pull back to make sure there's no blood in the hub, and then slowly inject. And the one-handed recap. Okay, now that the alcohol is dry, I've got my 25 gauge needle. And you can go down to a 27 also if it's a smaller bunny. Shannon here's got him restrained for me, and I'm just going to gently poke his ear. Oop. Got blood, but not in my hub. Sorry, buddy. Oops. Alright, I'm going to gently draw back on my hub. And I've got my blood. Now I'm just going to apply some digital pressure to his ear until it stops bleeding. Oh, you're such a cool bunny. Good job. That's a bunny blood draw on the marginal ear vein.
Alright, I'm going to restrain Sterling. I was trying to call him Silverman for some reason. Sterling here. The best way to first restrain a bird is with the towel. You put it over their head. I'm just going to explain it before I do it in case he starts panicking a little bit. You put it over their body and you get a hold of the head, and then you put your fingers on either side of the jaw area, the neck, without applying too much pressure. That way you can hold the head and make sure that they're not struggling or reaching down to bite both yourself or the person helping you. And then with my other hand, I'm going to end up holding onto his feet and stretching him out in case we needed to do the exam or any, oh buddy, I know, that feels good, any blood work or, hey, what are you doing? You're going to fall there. Any of that good stuff. So I'm just going to go ahead and take the towel over him. Oh, you're going to get mad at me now. You're awake now, huh?
There you go, just drop it. There you go. Oop.
You want to be very careful when you're doing this. You don't want to apply too much pressure because they are very delicate. Hi. Hi. I'm just going to make sure I have a good grip there. And then his feet. I know. I know. You're okay. There we go. Got him, and he can't get me, and I've got a good grip on him, but I'm not applying too much pressure so he can still breathe. Okay, Shannon has Sterling in a nice hold for me so I can trim his nails. And trimming the nails is pretty much like trimming cat and dog nails, is being careful of the quick and just taking a little bit at a time to see where you need to be at. Quick's not as obvious as it is in a dog or a cat.
Yeah.
So it's more important to be careful. I'll be nice. Stop it. You're being a brat. So I'm just going to show 2 nails, and then I'm going to stop it so I can finish the rest. These are hard to grip. And you're curling your toes. Stop curling.
Yeah, they're good. They have very strong feet.
Ow! Go! Oh my goodness, you're strong. With a smaller bird, you want to be especially careful not to quick them, because it could actually be deadly for them if you got too much of a quick, and it could stop bleeding. You can use quick stop to help with the bleeding. All right, I've got 2 nails done. I'm going to stop here and finish the rest, and then we'll come back. All right, this handsome little bugger is Sterling. His owner brought him in his travel cage, and in his travel cage, in the bottom of the cage, he has newspaper, his water bowl, and what used to be his food bowl, but he decided that he was stressed and threw a temper tantrum. His stool and his urine looks normal. There's no blood, parasites, nothing unusual that would be of any concern. Because he was very difficult to get out of the cage, the owner brought gloves. And just at a general quick look at him before actually handling him, we noticed that his eyes are nice and clear. His feathers look nice and clean until we messed with him. He stands pretty well on his feet. He was perching well on his little perch in there. His beak isn't overgrown. He looks all in all pretty healthy. Okay, while Sterling is hanging out on his cage, I'm just going to point the pen light at his eyes and see if he has normal reflexes. And his pupils are dilating and shrinking normally. They're both about equal. Good job. And I've looked in his mouth. It doesn't look like he has any sores. Hello. He's silly. His mucous membranes are gray. His tongue is gray like his coloring, so can't really tell much about that. But his skin looks nice and clear. His feet are clear, no sores. He's able to perch well, and he has good grip on both of his feet. We found that out the hard way. There you go. His nose is nice and clear. It's not super dry, no blocking. And from what I could see in his ears when I was holding him earlier, is they're clear. There's no debris in them. Huh. Isn't that right? Okay, since we've already gone down and I felt him and made sure that he was all good in his crocs, and we've already looked at his eyes and his mouth, his his ears, I'm just going to listen to his heart. He's been a little agitated, so his heart rate's probably going to be up, as well as his respiratory rate. So a normal heart rate for an African gray is around 200 to 350. He's a little on the higher side. He's about 300, 315. Respiratory rate for an African gray is between 25 and 30. He's obviously also agitated. Hi. I know, and now you're hot, so we're going to pull you back down again. You're all right. And so his respiratory rate is a little bit higher. It's closer to 30. I'm just going to let him relax again. And then I will show how to restrain. Well, we've got him held. I'm looking at his vent to make sure there's no redness or irritation, no swelling, no lesions, and he looks good there. She's just going to try to lift him up a little bit for me so I can feel his back. Hey, you settle down, you. Just going to stop it. Just going to feel along his his back if he'll allow me. You're being very stubborn. And some birds have a gland back here for grooming. And just make sure that there's no lesions or anything in there either.
All right, buddy.
And then you would check the wings, make sure that the wings are strong, that he could pull them back out of my hand with force but not hurt himself. You're a good boy, I know. You're very stubborn. And his wings are looking good. There's no blood that hasn't been pulling at his wings or his feathers. Good job. Other one. And he's looking pretty decent. Look at you. Now that we've got him all stressed out, we're going to let him go for a minute and take a breath. All right, I'm going to restrain
Sterling.
I was trying to call him Silverman for some reason. Sterling here. The best way to first restrain a bird is with the towel. You put it over their head. I'm just going to explain it before I do it in case he starts panicking a little bit. You put it over their body and you get a hold of the head, and then you put your fingers on either side of the jaw area, the neck, without applying too much pressure. That way you can hold the head and make sure that they're not struggling or reaching down to bite both yourself or the person helping you. And then with my other hand, I'm going to end up holding onto his feet and stretching him out in case we needed to do the exam or any... Oh, buddy, I know, that feels good. Any blood work or... Hey, what are you doing? You're going to fall there. Any of that good stuff. So I'm just going to go ahead and take the towel over him. Oh, you're going to get mad at me now. You're awake now, huh?
There you go, just drop it. There you go. Oop.
You want to be very careful when you're doing this. You don't want to apply too much pressure because they are very delicate. Hi. Hi. I'm just going to make sure I have a good grip there. And then his feet. I know. You're okay. And there we go. I've got him, and he can't get me, and I've got a good grip on him, but I'm not applying too much pressure so he can still breathe.